Hello everyone, this is Dr. Agalya, your organic faculty. Hope you are all doing well. We are going to discuss about perineum today. Perineum. So, what is perineum? Perineum is basically located between the thighs and it is the outermost anatomical portion of the pelvic outlet. Okay. So, perineum is basically a diamond shaped area. Okay. So, I'll show you the pic. So, this region is perineum. So, if you see, perineum is bounded anteriorly by the pubic symphysis and posteriorly by the coccyx. Okay. Laterally, we have the ischial tuberosities. So, basically, this is a diamond shaped area. Okay. So, this region is the whole of the perineum. Okay. Now, suppose if you are joining the two ischial tuberosities over here and draw a center line over here. Okay. This diamond shaped area will be split up into two triangles. The first one is the urogenital triangle and the next one is the anal triangle. Okay. So, what are the boundaries as we have seen? Anteriorly, we have the pubic symphysis. Posteriorly, yes, it is the coccyx, and laterally we have the ischial tuberosities. Right? Now, we will join the ischial tuberosities and the perineum can be divided into two triangles. The first triangle is a urogenital triangle and the next triangle is the anal triangle. Now, we will see about the urogenital triangle. Urogenital triangle. Now, let us discuss the boundaries of urogenital triangle once again. So, what will be the boundaries? Yes, anteriorly, we already have the pubic symphysis. And laterally, it is the ischial tuberosities and posteriorly, we have the superficial transverse perineal muscle. Okay. Now, this urogenital triangle is divided into two spaces. Okay, by a membrane called as perineal membrane. Okay, so this perineal membrane divides the urogenital triangle into two spaces. The first space is also known as superficial space or compartment and that is present deep to the perineal membrane is also known as deep space of the urogenital triangle. So, anteriorly we have the membrane that is coming from the abdomen from the carpus fascia, that is the collis fascia. So, this is the abdominal region. So, basically there is a carpus fascia. This carpus fascia continues onto the perineum as collis fascia, which becomes the anterior boundary of the superficial space. And this is the posterior boundary, that is the perineal membrane. Now, generally, the superficial space is a closed compartment, and what are the structures present in the superficial space? That you have to know. Okay. So, superficial space consists of number 1 is Bartholin gland, number 2 is clitoris, especially the bulb and crura of clitoris. Then you have the muscles, namely bulbocavernosus, ischiocavernosus and superficial transverse perineum, which is forming the posterior boundary of the urogenital triangle. Also, you have the vestibular glands. Right? Now coming to the deep space. Okay. So if you take the deep space, it is bounded by the perineal membrane, then perineal membrane anteriorly, and posteriorly we have the superficial transverse perineal muscle. Okay. So in the deep space, what are the contents we'll have? The contents of deep space include urethra, vagina and some of the branches of internal pudendal artery. Okay. So this is basically the perineum. We have discussed about the urogenital triangle now, and urogenital triangle, from the name itself you will be able to get, like us, the contents of the urological system and the genital system. Okay, the openings are present here. Okay, namely the urethra and the vagina. In the anal triangle, basically we have the anal sphincter complex, and these spaces are known as the ischiorectal fossa. We will see it further. And one more point I want you to add is, for the perineum, the roof is formed by the pelvic floor and the base is formed by skin and superficial fascia. Right? Okay. Now we will go to the anal triangle. So what are the contents of anal triangle? As we have already seen, it is the anal canal, anal sphincters, and then ischiorectal fossa. Okay. First we will see the ischiorectal fossa. So this is a picture to explain you what is ischiorectal fossa. If you see ischiorectal fossa, it is located on either side of the anal canal. So this is the anal canal, right? So this is the anal canal. On either side of the anal canal, ischiorectal fossa is based. Basically, this is nothing but the fat content. What do you see over here on either side of the anal canal? Okay. So ischiorectal fossa is basically a wedge-shaped space in other words, you can tell it is a fat-filled cushion, okay, seen on either side of the anal canal. So basically it is a wedge-shaped, and you have the superficial base formed by the skin and the deep apex formed by the meeting point of two muscles, namely levator ani and obturator internus. Right? Now, you will ask me, ma'am, why ischiorectal fossa, anal canal, so and so in obstetrics and gynecology? Because This region is also important to learn, children, like because while we are giving episiotomy, okay, so if there is any infection or hematoma that is forming, there is a communication between the ischiorectal fossa of both the sides. So if you give episiotomy in either side, either right or left, there is a chance that the infection or hematoma can spread to the other side also. Okay, so this anatomy is also important to know. Okay, coming to the anal canal. See, anal canal is 3 to 4 centimeter in length. Okay, so only the lining you have to know. Okay, so lining, the uppermost part of the anal canal is lined by a columnar epithelium, whereas the lower portion is lined by simple stratified epithelium. So the point of contact between these two epitheliums we called as dentate line or pectinate line. Okay, so when you do a rectal examination, you will be able to palpate this. Coming to the anal sphincteric complex. You have internal anal sphincter and external anal sphincter. Internal anal sphincter is nothing but the continuation of the circular muscles of the rectum. Okay, this sphincter is 3 to 4 centimeter in length, but there is overlapping between the internal sphincter as well as the external sphincter, and this overlapping happens for about some 1 to 2 centimeter overlap. So this will be seen as intersphincteric groove. Basically, this maintains the resting pressure in the anus. Next comes the external anal sphincter. So this is nothing but a striated muscle fibers, and it gives additional squeeze pressure during defecation. So if there is any injuries that is happening during normal delivery, there can be injuries to the perineal injuries happening during normal delivery, there can be injuries to the sphincter complex also. Okay, so that is the clinical importance why I wanted to explain you this. Now, if we see, the external anal sphincter is bound anteriorly to perineal body and posteriorly to the coccyx. Okay, now we'll see this picture for better explanation. So, this is the internal anal sphincter that is seen here. This is the external anal sphincter. It is further divided into a subcutaneous part, superficial and deep part. So, this we have the levator ani muscle. Okay. So, these are basically the ischiorectal fossa that is containing the fat. Okay. Now, we will see perineal body. Perineal body is known as the central tendon. It provides perineal support, and generally this is located in between the two triangles. So actually it is a fibromuscular sling. Okay. So if you see this picture, you will be able to understand what is a perineal body. So this is basically the urogenital triangle. This is basically the anal triangle. So in between the two junctions here, you have the perineal body. Okay. Now what are the muscles forming the perineal body? You have a superficial layer of muscles and deep layer of muscles. The superficial layer of muscles include superficial transverse perineum, and the external anal sphincter. In the deep layer comes the pubococcygeus, perineal membrane, and the internal anal sphincter. Okay. We have two diaphragms in the perineum. Number one is a pelvic diaphragm. Number two is a urogenital diaphragm. Basically, how we know the diaphragm in the thorax. Okay, so this is also that kind of a muscular attachment that is seen to give support to the organs present in the pelvis. Okay, so this is how the pelvic diaphragm and urogenital diaphragm are present. Urogenital diaphragm is present in the urogenital triangle. Okay, so now what are the muscles forming the pelvic diaphragm? It is basically the pelvic diaphragm. It is formed by number one, levator ani muscle, and number two is coccygeus muscle. Levator ani muscle consists of two parts, namely the pubococcygeus and iliococcygeus. Remember, there is no ischio-coccygeus. Okay. So, depending upon the location of the pubococcygeus, whether it is surrounding the rectum or anus or the urethra, it is further known as pubo-urethralis if it is surrounding the urethra, puborectalis if it is surrounding the rectum, and pubovaginalis. Basically, the urogenital diaphragm consists of deep transverse perineal muscles and the fascia surrounding the muscles. And urogenital diaphragm helps in maintaining the urinary continence. Okay, so this is another picture to show you the pelvic diaphragm. So this is the coccygeus muscle basically over here, and then you have the puborectalis over here. Okay, this is pubococcygeus muscle and this is the iliococcygeus muscle. Okay, so it comes like this. One important nerve of the perineal region you have to learn is the pudendal nerve. So pudendal nerve root value is S2, S3 and S4. So basically the pudendal nerve starts from these nerve roots and it passes via the greater sciatic foramen and near the ischial tuberosity. It lies just medial to the ischial tuberosity over there. Okay. Then it takes a turn back and enters again to the lesser sciatic foramen, and then it passes through the Alcock's canal. Alcock's canal is nothing but the pudendal canal, which is formed by the splitting up of the muscle obturator intertus. Okay. So, this is the major blood supply of the perineum. So, if any obstetrical procedures like even during if we need regional anesthesia during labor, during the second stage of labor, or any local gynecological procedures like repairing of vaginal tears, etc., we can block this pudendal nerve by locating the nerve around the ischial tuberosity. Okay. So, this is how ischial spine, that is this is how they will give the block. Okay. So, they will locate this pudendal nerve over here near the ischial spine and then they will give a block. Okay. And also another important artery we have to learn is the pudendal artery. So, basically the branches of the pudendal nerve and the pudendal artery are named like the same. So, the artery, it is the inferior rectal artery, the perineal artery and the deep artery of clitoris. The same comes for the nerve also. So, it is the inferior rectal nerve, it is the perineal nerve and it is the deep nerve of the clitoris. Okay. So, deep nerve of the clitoris supplies the clitoris, whereas this perineal artery and the nerve will supply this area over the perineal region, including the labia and the perineal skin. Inferior rectal artery and the inferior rectal nerve will supply the area here in the perineal skin, the external anal sphincter and the anal mucosa. Okay. So, this is all about perineum that we have to know in obstetrics and gynecology. Until we meet in the next video, keep going, happy learning and take care.